Hi, welcome to the classes with Nadia. In today's class, we can discuss about the measurement of drug concentrations. As drug concentrations play an important role in determining individual or population pharmacokinetics, drug concentrations are measured in biologic samples like blood, plasma, serum, saliva, milk, and urine. Generally, chromatographic and mass spectrometric methods are most frequently used. Chromatography helps separate the drug from other related materials that may cause assay interference, and mass spectroscopy helps detection of molecules and molecule fragments based on their mass to charge ratio. The first step in drug concentration measurement is the sampling of biologic specimens. Sample may be collected from body via invasive methods, for example, blood, spinal fluid, tissue biopsy, or any biologic material that requires parenteral or surgical intervention in the patient, or via non-invasive methods. Examples are urine, saliva, expired air, or any biologic materials that can be obtained without parenteral or surgical intervention. It is important that analytical method should be able to distinguish between protein-bound and unbound parent drug, and each metabolite and the pharmacologically active species should be identified. Such distinctions between metabolites in tissue and fluid are important for initial pharmacokinetic modeling of drug. After sampling, the concentration in blood samples are measured. The most direct approach to access pharmacokinetics of the drug in body is measurement of drug and metabolite concentration in blood, plasma, or serum. Besides plasma, drug measurements are done in urine, feces, saliva, and tissues, but for pharmacokinetic study purpose, mostly drug measurements is done in plasma. Okay, before that, we can discuss what is the difference between these blood, serum, and plasma. Whole blood contains cellular elements including RBC, WBC, platelets, and various other proteins. Serum, it is collected after centrifugation of clotted blood, and the supernatant fluid is called serum. That is, the clot is removed and the supernatant after clotting of blood and centrifugation is called serum. Serum doesn't contain cellular elements or other clothing factors from blood. Then plasma. Plasma is obtained after centrifugation of anticoagulant like heparin added whole blood. So we can say that when non-clotted blood is centrifuged, the supernatant is called plasma. It is a non-cellular fluid fraction of blood and contains all proteins including albumin and an anticoagulant. Now it's clear that the protein content of serum and plasma is not the same. Plasma perfuses all the tissues of the body. So we can assume that the plasma is in dynamic equilibrium with tissues, then changes in drug concentration in plasma will reflect the changes in tissue drug concentrations. And whole blood samples are generally harder to process and assay than serum or plasma samples, so we prefer always serum or plasma for drug concentration measurements. Plasma proteins are filtered from plasma prior to drug concentration measurement. Then drugs bound with plasma proteins also gets removed from plasma. This is the unbound drug concentration, and if concentration of drug is measured from unfiltered plasma, this is the total plasma drug concentration. And also total drug concentration minus unbound drug concentration gives bound drug concentration. During interpretation, the type of plasma concentration should be specified, whether it's bound, unbound, or total drug, etc. Then we can move on to plasma drug concentration time curve. Here is the picture of plasma drug concentration time curve. in which drug concentration in plasma at various time intervals after administration of drug is plotted against the time intervals at which they are taken. Once drug is administered into body, it reaches systemic circulation, then drug is distributed to all the tissues in the body and is also simultaneously being eliminated. Elimination can be through excretion and biotransformation or metabolism, or combination of both. Other elimination mechanisms may also be involved, like elimination in feces, sweat, or exhaled air. Now we can learn some parameters which can be derived from the plasma drug concentration time curve. MAC. MAC is the minimum effective concentration. As our assumption is the drug concentration in plasma is in equilibrium with tissues, the term MAC reflects the minimum concentration of drug needed to produce desired pharmacologic effect at the receptors. Then MTC, minimum toxic concentration, that is the minimum concentration needed to just barely produce a toxic effect. Then onset time, time required for the drug to reach the MAC. When more number of drug receptors are occupied with drug, the intensity of pharmacologic effect will reflect it. Or we can say that higher plasma concentration of drug produce a greater pharmacologic response. Then duration of action. It is the time period between the onset of action and the time for a drug to decline back to MAC. Therapeutic window. It is the concentration between the MAC and MTC. Peak plasma level. It shows the maximum drug concentration in the plasma and is a rough marker of average rate of drug absorption. Cmax is related to dose, rate constant for absorption, and elimination constant of drug. Time for peak plasma level, that is Tmax. It is the time to reach Cmax. AUC. It is related to the drug absorbed systemically. These are the parameters which we can derive from this drug concentration time curve. Then we can check what is the significance of measuring plasma drug concentrations. Most of the cells are richly perfused with plasma or tissue fluids. So, measuring plasma drug level is the better way of monitoring the course of therapy. And with proper informations like dose of drug given, time at which blood samples were drawn, and route of administration, the use of pharmacokinetic equations and models, we may describe the blood level time curve accurately and can be used to modify dosing for specific patients. So, this concentration measurement in plasma can be used to design for specific patients' dosing. And the third significance is plasma drug concentration measurement allows adjustment of the drug dosage in order to optimize and individualize therapeutic drug regimens. Besides all the significance, we should keep in mind that only pharmacokinetics data cannot predict the dosing regimens for individuals. We have to consider pharmacodynamic effects too in some kind of patients. So this is all for today's class. Thanks for listening. Bye.